Okay, and turn to the right. Yeah, look to the right, and you can see this big bulge of fat here that we're gonna remove. Okay, so normally what we do is, Fatima, we will actually remove this fat, and I do that from the inside of the eyelid. It's called a transconjunctival incision. We're gonna go through the muscle, we're gonna remove the fat, and you're gonna have a nice refreshed look for your lower eyelid. So here we are doing some local anesthesia, 1% lidocaine with epinephrine. We're going to infiltrate the lower eyelid near the subciliary margin. This is going to be the extent of our incision. Just draw back a little bit to make sure that there's no blood in the syringe. Use a 30 gauge needle, very small, and very small aliquots of local anesthetic being infiltrated. And you can see how the local anesthesia just sort of diffuses in the plane. When you're in the right plane, the local anesthetic just tends to just sort of migrate quite easily. So 2.5 cc's for one side, 2.5 cc's for the opposing side. So I'm just dissecting underneath the eyelash margin.
It's amazing how close you can get.
Yeah, and the closer the better.
Yeah.
I try to stay as close and tight as I can to the eyelash margin, Mel, so we have a nice view, nice incision, barely visible. And you can see how much extra skin we've already achieved just by undermining it.
I bet.
Now we're going to dissect out the fat in those 3 compartments. Okay, remember we have a nasal, we have a central, and we have a lateral. And if you look even here, right underneath this thin layer of fascia, you see the bulge of fat that really bothers her so much.
Yeah.
See it's coming into view there?
Yeah.
And if we gently push on the eyeball, you'll see the fat bulging forward.
Yeah.
And this is really the bane of her existence. This really bothers her. These are all moistened towels. We're very cognizant of the cornea, and we've given some solution to the cornea to ensure that the cornea is well lubricated. And you can just see fat coming out. Now it's really important to take out only what's needed. Sometimes when you take out too much, you can get actually a bit of a hollow appearance. In her case, I don't think we're going to have that issue, but it's really important not to take out too much. The fat that we removed from each of those individual 3 compartments. So this was the lateral compartment, this was the medial compartment, and here was the central compartment. And then we took a small strip of skin from the lower eyelid. Okay, so now we're going to do a similar procedure on the opposing side. Okay, so let's just do that now. And I'm going to keep these specimens here just for comparison's sake before we ultimately close. You know, aesthetic issue really affects people, and I think
self-conscious.
Yeah, exactly.
Yeah.
So here we are, a subciliary incision. We're just going underneath the skin, just making a small little pocket. Okay, I like to make this incision as close as I can to the eyelash margin. Several advantages. Number one, not visible. You know, that's probably the most important. Number two, I like the pull that it allows me to yield on the lower eyelid. to really rejuvenate that structure. I've seen some people with very low eyelid incisions, almost
Yeah.
here, and it's just so visible. Like I just don't really like that incision. So we're just releasing some of the soft tissues here. Okay, good. Just here. Moist sponges are always better. And same thing, now we're going to just look for those same 3 compartments of fat. And as soon as we get through these superficial fascial layers, it almost jumps out at you. So make sure we don't touch the eyelashes. And angle these scissors away from the eyelashes. All right, I'll do the same thing.